Hi everyone, my name is Nicole Pfeiffer and I'm the Family Planning Sustainability Coordinator here at the Colorado Department of Public Health and Environment. And today I'm going to be talking a little bit about ways that WIC and the Colorado Family Planning Program can really work together to promote the health of mothers, babies, and families throughout the state of Colorado. Now, to give you a little bit of an idea of what's going to be discussed during today's presentation, our objectives are to understand the risks associated with unintended pregnancy, learn about the services offered for WIC participants at Title X family planning clinics, to understand basic information about contraception and specific concerns for breastfeeding, postpartum, and obese women, and to learn to locate and connect WIC participants to the nearest Title X clinic. So, to begin with, why does it make sense for WIC and the family planning program to really work together on now what's considered to be a winnable battle against unintended pregnancy? Well, for one, we know that WIC participants are at a heightened risk for unintended pregnancies. Over half of WIC participants reported their last pregnancy as unintended versus just 27.4% of women in Colorado who reported their last pregnancy as unintended. We also know that women who have had one previous unintended pregnancy are at a heightened risk for a future unintended pregnancy than are women who have never had an unintended pregnancy in the past. And so what? What's the big deal about unintended pregnancy? Well, we know that there's a broad spectrum of negative impacts socially, medically, educationally caused by unintended pregnancy. You can see here that increased risk of preterm birth, lower birth rate, lower educational attainment, delayed entry into prenatal care, increased rates of abortion, increased reliance on public assistance, increased risk of postpartum depression are all associated with unintended pregnancies. And the list goes on and on and on. So it makes sense to work together to try to stop this from happening. Additionally, we know specifically when it comes to WIC that a lot of the WIC nutrition risk criteria relate to unintended pregnancy. Now, I won't read all of this, but we know that pregnancy at a young age, closely spaced pregnancies, high parity in young age, and lack of or inadequate prenatal care are all risk factors outlined by the WIC program that relate directly to unintended pregnancy. So how does family planning fit into all of this? Well, given that your job is to really help avoid these risk factors, our services can really assist you in doing so. For example, if you take pregnancy at a young age, family planning services can help women delay a subsequent pregnancy beyond adolescence. If you're talking about closely spaced pregnancies, family planning services can help women choose, if that's what their decision is, to prevent a pregnancy for at least 2 years after giving birth. If you're talking about delayed entry into prenatal care, we know that planned pregnancies really allow mothers the time to prepare to access prenatal care. So by allowing them to plan their pregnancies and giving them information about prenatal care, we know we can help them to access it. And all this combined really results in healthier women, infants, and children, which is the goal of both of our programs. Now, the Colorado Title X Family Planning Program currently distributes federal tax dollars to 68 clinics that are run by 28 agencies throughout Colorado. And all of these agencies offer birth control information and supplies, pregnancy testing and counseling, screenings for sexually transmitted infections, physical exams, certain cancer screenings, health education and counseling, infertility services, referrals for sterilization services, as well as referrals to other health and social services. And really the takeaway message is that they don't just provide birth control pills or something very specific like that, but very comprehensive and holistic sexual health services. And additionally, all of these services are confidential. So many of our clients choose to use these services rather than a primary care physician because that's a setting where they feel the most comfortable. However, if one of your clients does have a primary care physician that he or she feels comfortable with, we certainly encourage them to seek their family planning needs there. So who can access services at Title X clinics? Women and men of any relationship status, any age, including teens, any sexual orientation, and any immigration status. Basically, anybody can access Title X services. Additionally, it's really important to note that participants don't have to live in the same county as the clinic they attend. So if your clinic is located on the border of one county and there's a great Title X clinic that's located just across the border in the other county, and that's the easiest for your participant to get to, we certainly encourage you to refer them to wherever is easiest and most comfortable for them to access. Now, one of the real strengths of the Title X family planning program is that patients are never turned away due to inability to pay. So if they have Medicaid or they have private insurance, our clinics can accept that. However, if they're uninsured, as many participants or friends or family members of participants might be, they are welcome to go to a Title X clinic where they will be charged for services based on a sliding fee scale. So let's say you have somebody who you know wants to attend a Title X clinic. Where can you find information to refer them to? So basically, our family planning page includes an online clinic locator as well as a downloadable PDF directory of all Title X clinics. So if you just click on the link at the bottom of the PowerPoint or enter in that address to your browser, you'll see you can type in the patient's home address, you can type in a zip code, or just a city name, and find directions by walking, biking, public transit, and by car to get to the nearest family planning clinic. Additionally, by clicking on a clinic's address on the clinic locator, you, as I had stated, can get directions by all of these means. Once you see the clinic that the patient wants to attend, you can have them call the number associated with the clinic to schedule an appointment. So that number is right up on our clinic locator. And while some clinics offer walk-in hours, it's generally really advisable to call and confirm these ahead of time. So you really want to stress to your participant, please call in advance to make sure that, when you show up, somebody will be there to see you. So now that you have kind of a general overview of what Title X family planning clinics offer, I'm going to give you a bit of an overview of birth control basics for WIC. Now, we're not asking you to be providers by any means. Obviously, you can't prescribe any of these methods, nor should you know the ins and outs of these birth control methods. However, you may have been seeing a participant while she was pregnant who then, says, oh, I'm just going to use the same type of birth control I used before my pregnancy. And maybe the situation has changed for her. So you might want to be able to identify some key risk factors or key talking points that might throw up a red flag for you to say, hey, you really want to get in and talk to a provider about that, or what you're doing right now may not be effective. So our general rule for family planning methods at this point is the less you have to do, the more effective the birth control method tends to be. Right now, we're really promoting the use of long-acting reversible contraception, or implants, IUDs, or implants and IUDs. Basically, these are 20 times more effective than birth control pills. The saying is that you get it and forget it. They're appropriate for obese women, and they can be removed at any time. And what they are IUDs, are T-shaped devices made out of either plastic or copper that are inserted into the uterus to prevent pregnancy. Contraceptive implants are just small plastic rods that are inserted under the skin of the upper arm that also can prevent pregnancy. And these can prevent pregnancy for years at a time. So IUDs can be designed to prevent pregnancy anywhere from 3 to 10 years after insertion, whereas the contraceptive implant is effective for 3 years. There are two different types of IUDs. There are hormonal IUDs, which are our Mirena and our Skyla, which really create a low dose of a localized hormone in order to prevent pregnancy. So unlike birth control pills, where hormones are kind of more systemic and going throughout a woman's entire system, these really stay more localized to the uterus and therefore have some fewer side effects than birth control pills traditionally do. The copper T IUD, or the Paragard, is hormone-free, and that's the one that lasts for 10 years. And it can be inserted immediately after delivery and used while breastfeeding. Whereas our Mirena and our Skyla can be used by breastfeeding women after 4 to 6 weeks postpartum. And our Nexplanon, which is the contraceptive implant, uses the hormone progestin to prevent pregnancy, making it a good option for women that might not be able to take estrogen. And it can be inserted after delivery and used while breastfeeding, which kind of makes it a popular option during that period. So many of your participants who you see might be breastfeeding and postpartum women. So what are some considerations you should know about for them? Basically, women should not use combined hormonal contraception, so that's any type of birth control method that includes estrogen, during the first few weeks after having a baby. It can increase the risk of blood clots, so we really advise against it. And these methods with estrogen tend to be your combined oral contraceptives, the patch, and the ring. So if you have somebody that says, oh, I have a patch left over from before I was pregnant, I'll just use that, you really want to tell her that that's probably not an appropriate method, that it can actually be a dangerous method for her, and that she would want to talk to a healthcare provider about an alternate method. Additionally, breastfeeding women should not use an estrogen-containing method, like the ones I mentioned above, until basically 4 to 6 weeks after postpartum. And that's really just due to concerns about breastfeeding duration and success when it comes to the production of milk. And some providers indicate that using an estrogen method shouldn't be advised during breastfeeding at all. So if the woman's breastfeeding, not to use it at all. On the other hand, progestin-only methods, including oral contraceptives or the mini pill, Depo-Provera, which is the birth control shot, and those Nexplanon implants can be started at less than 3 weeks postpartum, regardless of whether a woman is breastfeeding. So the real bottom line takeaway message here is that women should speak with a healthcare provider about their choice of postpartum contraception. And you just really want to drive the point home, even while a woman is pregnant, that what worked for them before they got pregnant might not be appropriate directly after having a child. So one thing that you might pretty typically hear is, but I can't get pregnant if I'm breastfeeding, right? Well, not exactly. For most women, lactational amenorrhea, or the idea that you will not be fertile while breastfeeding, is not a reliable method of birth control if they're only using that alone. Lactational amenorrhea really requires a lot to be effective. It means that a woman must be full or nearly full breastfeeding, which means they can't be expressing milk by their hand or a pump. They have to have not had any periods, and the baby has to be less than 6 months old. So it can just be kind of difficult to really get all that right. Some other things that you might want to know, you might hear clients talk about emergency contraception, or they might come to you and say, you know, I just had unprotected sex, what are my options? And of course, you always want to refer them to a healthcare provider, but they should also know that emergency contraception can be taken after intercourse to protect from pregnancy, meaning that pregnancy isn't inevitable in any means. They can actively do something to prevent it even after unprotected sex. That all types of emergency contraception really prevent the release of an egg. They do not affect an existing pregnancy. And really that pills can be purchased in advance for women to keep on hand. So if you know that you have a participant who is engaging in high-risk behavior, it might not be a bad idea to suggest that she has some emergency contraception on hand. Now, right now, there are 3 types of emergency contraception. The Paragard IUD, which I mentioned earlier, is the most effective form of emergency contraception. A woman, after having unprotected sex, can go to a physician. The IUD can be inserted up to 5 days afterwards, still be highly effective, and its efficacy is not at all affected by a woman's BMI. We also have 2 types of emergency contraception pills that women can use. We have Ella and we have Plan B. Ella can be taken up to 5 days after sex, and it's considered to be a little bit more effective than Plan B because its efficacy doesn't decrease over time. So if you take it on day 1 or you take it on day 5 after unprotected sex, it's going to be equally as effective. However, it's available by prescription only, so a woman would have to speak with her healthcare provider in order to get a prescription for that. Then we have Plan B, which can still be taken up to 5 days after unprotected sex, but it is less effective over time, meaning if you take it directly afterwards, you have a much better chance of not getting pregnant than you do if you take it 5 days later. The real advantage of Plan B is that it is available over the counter to anyone who is 17 and older, and these guidelines recently changed, and we can get you more information on that with regards to age, but the takeaway message here is that it's available over the counter without a prescription, so a woman doesn't have to see her healthcare provider before taking Plan B. So another issue that was brought up or came to light during our survey was that many of you had concerns or wanted to know more about contraceptives and women who were obese. So some things that you might want to be able to talk to your clients who have a high BMI about are the efficacy of their birth control. So for example, Plan B may not be very effective in women with a BMI above 30, and Ella may not be effective in women with a BMI above 35. So if you have a participant who meets those sort of criteria for BMI and they say, well, I'm just going to take Plan B and that's my plan, you might want to say, no, you really might want to go speak with your healthcare provider about getting a copper T IUD or seeing what your options are, since that your plan may not actually be effective. Obese women who do not have additional risk factors can use any birth control method. So sometimes there are myths out there saying that, if a woman is extremely obese, that her risks increase exponentially by taking, birth control pills. If that woman is not suffering from hypertension or another kind of compounding factor, then it's fine for them to take any type of birth control method. However, they should know that the patch may not be as effective for women who are over 198 pounds. A Nexplanon, that contraceptive implant, is very effective, but it's not known if it is as effective in overweight women as it is in women who are not overweight. Additionally, obese adolescents may be more likely to gain weight using Depo-Provera, or that birth control fat shot, than non-obese adolescents. So once again, if you have a woman with a high BMI who's, interested in various methods of birth control, or suddenly has had an increase in, weight gain and wants to continue using their former form of birth control, just really want to stress the point that they want to talk to a healthcare provider about that. So this is a lot of information. At the end of the day, what are our key messages surrounding family planning for WIC participants? Well, the first is really has to do with birth spacing and timing. You really want to drive home that babies and families are healthier when pregnancies are planned. You also want to drive home the message that spacing is important. Research shows that moms and babies are healthier if you wait until your youngest child is at least 2 years old before getting pregnant again. We also want to tell the client that if she is a teen, we want to advise her to wait to become pregnant again beyond adolescence, just due to all of the financial and medical